My name is Andreea Furtuna and I work for the Romanian Red Cross since 2006. My current position is Programs Director and I coordinate the core programs of the organization: social, health, volunteering and youth, and also organizational development, communication and IT. Romanian Red Cross is the organization auxiliary to the state according to the law, and it implements activities all over the country in 47 branches with approximately 100 staff and over 6,000 volunteers. In March 2020, our organization was designated by the Romanian government as the principal recipient of donations, both in money and also in kind. And so we succeeded in helping almost all the medical facilities in the country and other residential facilities, the authorities, and everybody who needed protection materials and medical equipment. It was a difficult period for us as we were facing the same challenges as other stakeholders along the continent and all over the world, with no stocks and with a fight on every resource. But we had to be strong and to solve it out somehow. We faced fear and unknown, and we decided to work only with experienced volunteers, although everybody wanted to do something. So we used those volunteers who were really trained, who were adults. We also faced fake news and a lot of social media attacks, given the fact that we were receiving a lot of donations, and this was also capacity building for us. We had to train our staff, we had to find information materials on time from real sources and to deliver them into the country. We had very good partners that helped us implementing this information campaign. We succeeded in continuing informing the population after the lifting of the emergency situation. We had to continue with information like stress management and safety in schools. We went door to door in rural areas in order to make people understand what is COVID and what they have to do in order to protect themselves. And when the vaccines were available, we participated in the vaccination campaign, both with information and supporting the vaccination centers, so we can contribute the best in fighting this disease. And we will continue until everything is done.
Hi, shalom. My name is Itamar Laist. I'm from Magen David Adom in Israel, and we are partners in the COVINFORM project. Magen David Adom, or MDA, is the national emergency medical services provider in Israel, providing ambulance services, advanced and basic, all over the country using a fleet of more than 1,000 vehicles. We have ambulances, helicopters, motorcycles, all-terrain, and other special vehicles. MDA is also the blood services provider in Israel, collect, process and distribute blood products to hospitals all over the country, and is the National Society member in the Red Cross and Red Crescent movement. In MDA there are 3,000 staff members and some 30,000 volunteers. Since February 2020, like in many other countries, in Israel we were impacted by the COVID-19 pandemic. First we had only several cases, but later we saw in different outbreak waves some tens of thousands of cases regularly every day in the different outbreak waves. And of course this is not something that we were used to in MDA, and it affected the way we work. Of course, during the pandemic we had to continue with the ambulance services we provide, So for regular routine non-COVID cases, we treated and transported the patients like we normally do, only we had to use a higher level of personal protective equipment than we normally do. So not only gloves, but gloves and face mask as well. For the suspected COVID or confirmed COVID cases, we used even a higher level of personal protective equipment. We used the 2 pairs of gloves, coverall gown, face mask, and transparent face shield on top of it to protect ourselves. And it is very difficult to treat while using this personal protective equipment. First, it takes some time to wear it, and then after you are in it, it's very hot and inconvenient, and the hearing is not as well. You can see as well as you used to. So we changed the way we interact with our patients. We try to protect our personnel as much as we can. So some of the ambulances were converted into isolated ambulances. So the front cabin was separated completely from the back part of the ambulance where the patient is. By doing that, we minimize the exposure of our personnel to the patients. The patients were continuously monitored, and if needed, of course, they were treated. We also used Busbulance, which is a bus that was converted into a large ambulance. 15 patients can be transported in this Busbulance, and it reduces the number of vehicles needed for transporting or treating large numbers of patients or confirmed cases. Besides the routine or the pre-hospital medical care that we provided, we were requested by the Israeli Ministry of Health to sample and test people for COVID-19. It was done in several ways. First, in drive-through complexes, where people simply came with their cars, stayed in the car, and we sampled them while sitting in their cars. Again, reducing contacts between people and also between people to our personnel. We also sampled in MDA stations, in houses when the people cannot leave their house for any reason. And we used some new or some methods that were developed by MDA. For example, we placed containers, large containers, in crowded places, and these containers were isolated. So inside we had our personnel, and people could approach the container from the outside, and then we sampled them, and again reduced the contact with the patient. We also had some ambulances that were designed in the same way. The sampling personnel are within the car, and then people come from outside, and then we can sample them. Later, when the vaccine was available, we were again asked by the Israeli Ministry of Health to support the vaccination campaign in the country. And Magen David Adom vaccinated the most vulnerable populations. We vaccinated in elderly homes and in other long-term care facilities. Some 200,000 people, residents and staff were vaccinated by MDA with the first, second, third, and fourth dose of the vaccine. And we also vaccinated in remote places and in other vulnerable groups in the country. Besides that, we were involved in several other activities during these 2 years of pandemic. MDA Blood Services collected plasma donations from recovered patients from COVID-19, and it was used in certain phase of the pandemic as a treatment protocol for COVID patients, for severe COVID patients. MDA call center, which is similar to 112 center in Europe, where the emergency calls for ambulances are coming to. We converted some of the call center stations to COVID-19 call center, where people could call and ask questions about COVID and what they should do in certain situations, and MDA call takers provided information and supported them through the phone lines. As an organization that is very much involved in the community, and we have a lot of volunteers, it was very important to us to also engage with the community, and we did it several times during the pandemic, also explaining about ways and means of self-protection for the general public, how to protect themselves, how to avoid infections, what they should do if they have symptoms, providing information about the disease and about the activities the public should take. And later, when the vaccine again was available, or during the vaccination campaign, we provided information about the vaccine safety, and tried to encourage people to be vaccinated. We also used our experience and knowledge from Israel, and using the broad networks and friendships that we have with other organizations all over the world, we could share from our knowledge and exchange information about what we know and what we experienced, and also, of course, to learn from others. That was very much valuable for us, and it helped us prepare better for what we expected to see in the very near future during the pandemic. And when looking in the long term, the pandemic, of course, affected Magen David Adom and changed the way we do some of the things. For example, now, even though we don't see many COVID-19 cases, we still use PPE in every contact with patients. We still use the face masks, and that is new and will probably stay with us for the near future. And of course, we are always alert and try to identify if the patients that we're treating are somehow could be COVID-19 patients, and we are alert for new outbreaks and new possible diseases. Thank you.
Hello, my name is Massimo Fantoni. I am a doctor, specialist in infectious diseases, and I have been the head of the COVID hospital at the Gemelli University Hospital since February 2020. With my team, we have gone through all the phases of the pandemic, from the admission of the first cases in February 2020 until today. I must say that the impact on both a professional and a human level has been very strong. At the beginning, our feelings were dominated by uncertainty, the desire to make ourselves useful, the great energy we had for the task we had been assigned, and indeed a little fear of contagion, especially among the oldest among us. In these years, we took care of thousands of patients, being a referral hub for our region. Indeed, for the same reason, we had a higher case fatality rate when compared to other hospitals, since we also have admitted more serious patients with numerous comorbidities. The turnover of nursing and medical staff was very high, as many staff had to return to their services of origin once the Gemelli Hospital's activities gradually resumed their normal activity. In my team, for example, there was in 26 months, there was a turnover of over 100 physicians, which of course was a huge challenge in terms of team building. For us medical specialists, from a professional point of view, it was and still is a great cultural and scientific challenge. From the very beginning, we had to maintain a daily level of scientific updating. We also had to make a great effort to select between the scientific literature of good quality data and the huge amount of poor quality data that were nevertheless being published in the tumultuous months of the start of the pandemic. Another issue was that our patients, and indeed also the general population, were also a bit disoriented by the amount of news that was being disseminated, as of course they did not have the tools to distinguish between good quality scientific data and outright fake news, as we all know. This patient orientation was also tiring for us and sometimes led to real misunderstandings with our patients and also with the general population. So I do remember many cases in which we really did not know how to face and to say the right thing in the right place. An important turning point, of course, in the history of the pandemic was the arrival and the spread of vaccines. In our country, the vaccination campaign was very effective, reaching very high adherence rates within a reasonable time frame. This has changed the clinical spectrum of the disease very radically. As a paradox, we initially observed a decrease in the average age of hospitalized patients and eventually an increase in the average, having admitted many patients in whom the severity was caused by other diseases and not directly by the SARS-CoV-2 virus. This has meant, from both a medical and a nursing perspective, the need for an even more pronounced multidisciplinary approach than the first year and a half of the pandemic. Today we find ourselves in an even different epidemiological situation, with a decrease in the number of infections, some things we had also observed in the previous 2 summers, 2020 and 2021, but with a considerable margin of uncertainty about what will happen in the fall, in autumn, partly because of the spread of new viral variants, which we really don't know what's going to happen, and so there is a good margin of uncertainty. On a human level, the COVID experience as health workers has been very rich and challenging. In the beginning, we felt we were the absolute protagonists, the sort of stars of the pandemic response, which of course is not the case nowadays. We shared the discomfort of our patients forced into isolation, especially the older ones. We experienced with a considerable amount of stress the need to care for our patients completely wrapped in our DPIs, which inevitably created a distance between us and our patients. As the months have passed, a certain weariness has set in. And perhaps for some, today there is also a sense of emptiness. We are aware, however, that we have given as much as we could, and we'll continue to be here as long as we'll be needed. Goodbye.